All right, today I'm going to be talking about generalized anxiety disorder. Generalized anxiety disorder is one of the most common anxiety disorders, and it's also a future-oriented mood state. It's very hard to control your worry, and you worry a lot about maybe job, family, school problems, and your mind never really gets rest when you have generalized anxiety disorder. It's one crisis after another, and you just really have a hard time controlling your worry. Is basically what it is. And there's certain criteria that has to be met. It affects about 6.8 million adults in the U.S. And the criteria for this is excessive anxiety and worry, more days than not for at least 6 months about a number of events or activities. You have to have 3 or more of these 6 symptoms: restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance. And you have to have these for more days than not for the past 6 months. Also, it has to be clinically significant distress or impairment. It's not due to substance abuse, and it cannot be better explained by another disorder. And GAD in children, you only need one physical symptom present. As far as statistics, prevalence is about 3.1% a year and 5.7% a lifetime. And this onset happens mostly in early adulthood due to just life stressors. A lot of college students, they'll develop during that time. Kind of in your later years, and it's a chronic course, and also the median age is about 31, and I know a lot of people that have GAD in college, which is, I think, not surprising because college seems to be very stressful, and there's a lot of future-oriented things going on in college where you're trying to make decisions for your future, and about 2/3 are female. Adolescents is about 1.1% a year, and the elderly is about 10%. And I'm sure in a lot of nursing homes you're going to find this just because they're worried about their health. It's failing, probably a lot of loneliness, especially in nursing homes. And the 8% probability of becoming symptom-free after 2 years. The causes of generalized anxiety disorder, biologically, it's said to be an autonomic restrictor. What this means is individuals that have this show less responsiveness to heart rate and blood pressure. So compared to panic disorder, where you have higher heart rate and higher blood pressure, this is going to lessen it. And it's an inherited tendency to be tense, and your muscles are going to be very tense. And it's said that this can be inherited. Down the line, your family members could also have GAD. As far as psychological, you can develop a sense early on that important events in your life may be uncontrollable and potentially dangerous. And this kind of ties along with environmental factors, I think, just with the trauma and stressful life events. It kind of just messes with your head, and many people who have GAD just can't handle everything that gets thrown on them. And it's also psychoanalytical cause. It's kind of the conflict between the ID and the superego. Treatments for generalized anxiety disorder, cognitive behavioral treatment, which is CBT for short. Patients evoke worry process during therapy sessions and confront issues head on, which is a big thing, is because you can talk to the therapist about what's going on, and you can kind of say you're worrying about where you're going to work, and you can talk to the therapist about this and kind of just confront your issues head on and know that this is something you can't control. Relaxation training and meditation, it helps teach people how to be more tolerant of these feelings and how to handle it. And psychological treatments are found to be better long term, which I can definitely see helping, because the medications that you have to take, they're only going to offer short-term relief. They're not going to get to the root of the problem and to the root of what's really causing you to have anxiety and I guess panic really ties along into that most of the time. And also, like benzodiazepines, when you prescribe these, there is a risk of cognitive and motor functioning impairment. Antidepressants, like SSRIs and SNRIs, which is like Paxil and Effexor, may be better choices. And that's how when they prescribe you antidepressants, a lot of times depression and anxiety kind of tie in. So a lot of people, there's a lot of comorbidity with that. There's a lot of side effects to these medications, as far as like they'll make you nauseous, they can make you dizzy, so it's definitely better to go along with the psychological treatments. I wanted to talk about this just because I had to struggle a lot with anxiety, so I felt like talking about this disorder was really something that could help me because I learned a lot about it. And I can definitely see how medications, just from personal experience, are short-term relief. And your psychological treatments are going to be better because you always have to talk about things, always have to talk about the things that bother you, just, to lessen that anxiety. And even though most of the time you're still going to just jump from one crisis to the other, as I mentioned earlier, it's still better to just talk through these things and maybe just lessen the anxiety a little bit. And that's all I've got. I really learned a lot about GAD, and I hope this kind of just showed how much I learned about it, and I really enjoyed just kind of gaining knowledge on this since it kind of affects me personally.